Good morning, ladies and gentlemen, and welcome to this lecture series on safe patient handling and lifting techniques. This lecture series is meant to train the rehabilitation worker on how to safely handle patients so that they do not cause injury to themselves or to the patient. We know that there are a lot of risks that are there for health workers in terms of hitting their own backs, especially when they are carrying out lifting techniques. So this lecture series will help you know exactly how you can safely handle a patient without hurting yourself or the patient. So in this lecture, we intend to do the following objectives. We tend to describe, basic anatomy and biomechanics of the back and related structures and how these may result in musculoskeletal injuries. We also intend to discuss some common causes and risks of musculoskeletal injuries among rehabilitation workers, as well as, outline the principles of safe patient handling and within the care setting. And then we're going to describe a couple of lifting techniques that one can actually use for both lifting patients as well as some of the equipment that we utilize within our rehabilitation spaces. So let's dig into it. So we know that there are a lot of risks that are there in terms of patient care. Some of these risks come because of the nature of the work that we do. These include, reaching out to loads that are far away from the body. When we talk about loads far away from the body, oftentimes between ourselves and our patients, there are always barriers of some of the furniture and equipment that we utilize. So sometimes we are then forced to reach out to, touch those patients. This puts you at risk of developing, musculoskeletal disorders, especially those of the lower back, which we know from anatomy, it does not have a lot of support. And, the small muscles of the back are the ones that hold up, the body and the body's weight. So if a turning force is then generated this far from the body, it might result in a musculoskeletal disorder. We also know that most of the things that we do require us to be lifting heavy loads. Most of the clients that we take care of, especially when you look at neurological disorders, are the elderly, which might be in the 50, 60, 70, 80 kg range, which is far beyond the recommended 18 to 23 kilograms that individuals are supposed to lift without straining themselves. So you will see that this also then puts the health worker at a lot of risk when they're trying to assist their patients to either mobilize from one surface to the next or to within the purviews of gait training. Then there is a lot of twisting that also occurs, because of the nature of the movements that are then required for us. So this also puts rehabilitation workers at risk. Then we tend to reach to a lot of objects on the low as well as high when beginning a lift. Oftentimes things are not at the recommended heights that they are supposed to be. Some things are on the ground and we need to bend down to lift them up, or the patient is in a wheelchair, which is far below our own center of gravity. So we need to then bend over to reach down to pick up that client and assist them to move to the next surface. Or sometimes we need to take some of our equipment from high shelves and things like that. So this also puts us at risk of developing musculoskeletal disorders as rehabilitation workers. Then moving on, oftentimes we need to have loads move great distances from one space to another. So this also puts us at risk because of the nature of the sustained strain that is there to counterbalance the weight of whatever load that we will be moving across the distance that is there. We know that in physics, we say that work done equals to force times distance moved. So the greater the distance and heavier the weight equals to the more work that is done by the muscles that are counteracting the effects of gravity on that object. So this also puts the body at a lot of strain in terms of the musculoskeletal structures that then sustain this work or that then do this work. Then we tend to be continuously lifting throughout the day, and there is no rest for most of our tissues. There is a lot of high frequency that are there with as much as 12 lifts in a shift. If you consider if it's an 8-day hour with some of the patients that we treat, you're working on a neurological unit, or maybe it's a musculoskeletal unit, we'd say that, if you're going to be treating a client an hour, then you have about, 7 to 8 clients in the day. And in the majority of those will require you to do some form of lifting or weight supporting, whether it's in gait training, whether it's in moving from one surface, maybe the wheelchair, to a treating surface, which is on the plinth. Then these, continuous, strains that are there throughout the day, or the frequency of, how you then exert these forces will result or put you at greater risk of developing musculoskeletal disorders. Then oftentimes we tend to also operate and not have assisted lifts. When we say assisted lifts, we mean that, using equipment to help us lift our patients. Oftentimes we are using ourselves and our bodies, and this also puts us at risk of developing musculoskeletal disorders. Sometimes we are first with what we call a single high load incident. This is when one load, maybe it's a big patient, weighing 90, 100 kgs, and you are supposed to then lift them and move them from one surface to the next. That single event can put you at a great risk of developing musculoskeletal disorders if not handled in the proper way. So sometimes these, which often are inevitable events within the therapy setting, then lead to musculoskeletal disorders within rehabilitation workers. Then awkward postures for sustained for long periods of time. Sometimes, you're bent over and you're trying to, assist the client to, maybe roll in their bed in terms of bed mobility exercise or something like that. So this might also, put you at risk of developing musculoskeletal disorders. Then we talk about, chronic strain on muscles and joints, as well as, an imbalance in terms of the activities that we do. So when we talk about chronic strain, we mean, constantly the muscles are under strain, and oftentimes this is related to that imbalance in terms of repetitive activities. We are expected to do the same motion in treating using a particular technique, and this then, results in a lot of repetitive, monotonous activities and motions that we then engage in. And this can put us at risk of developing musculoskeletal disorders. For some of us, it's an issue of, poor living or lifestyle choices. Those that smoke, the muscles are not as healthy as they should be because they're not receiving enough oxygen. Then they become, easily susceptible to strain. And sometimes it's also about poor nutrition. If you don't eat well and feed well, then you don't have healthy muscles and healthy structures to sustain you. And oftentimes it may lead to some of those struggles that we talk about. The repetitive wear and tear. When we talk about repetitive wear and tear, we mean that over time, there is a reduction in terms of the spine's flexibility as one ages, and, utilizing it constantly creates micro tears within the spine, which, when they heal, becomes scar tissue. And, again, might result in a lot of musculoskeletal disorders and pain because it's no longer as flexible as it used to be, at the beginning. So that can also lead to that. Then we talk about what we call psychological factors. Oftentimes people think that musculoskeletal disorders are only because of the physical force and exertions that are there. But you see that a greater percentage of musculoskeletal disorders are as a result of what we call psychosocial factors, which are, factors within, the way that we, interact with others, interact with tasks, and think about this task that we talk about. So we can talk about issues like, being stressed, which can result in, a lot of us not, then taking conscious awareness of, joint protection and engaging in the proper way, as well engaging in our tasks, because we are often absent-minded. So that can result in us, putting us at greater risk of musculoskeletal disorders as rehabilitation workers. Then the other thing is time pressures. Oftentimes we then have, because we want to utilize the least amount of time, we then tend to ignore some of the laws and techniques that we're supposed to do in terms of proper joint mechanics. And at the end of the day, we put ourselves into awkward postures and repetitive strains, which put us at greater risk of developing musculoskeletal disorders. Monotonous work, which is boring and repetitive, people tend to then relax and not take much focus in terms of what protecting themselves against musculoskeletal disorders. Then we talk about heavy responsibilities. Oftentimes when the responsibilities are heavily on you, You then don't take care of yourself because you need to ensure that the work is done, or too many tasks, or not getting enough breaks so that you rest from that activity that's happening. Then we talk about having low control, which means that others push for what they need you to do, or it's the system or the environment that then force you into certain postures and certain positions that may put at risk of musculoskeletal disorders. Then we talk also about poor social support from peers and supervisors, which may be a way of alleviating most of these psychosocial issues. If that then does not exist, oftentimes you will see that that individual might then develop a musculoskeletal disorder. When we look at some of the things that we do, just to reiterate all the points that I have been highlighting, there is always issues that relate to the care itself that we do. So we need to then look at some of the unexpected or expected issues that might come up that we then need to be cognizant of in terms of developing musculoskeletal disorders and rehabilitation. So the first one is an unexpected change within the lift. Sometimes you might have a combative patient, someone who is resisting to be lifted, or the patient slips and starts falling. That change in the directionality of the lift might result in us trying to quickly adapt to the change and then put ourselves at a greater risk of developing a musculoskeletal disorder because of the poor biomechanics that might be involved. Then excessive pushing and pull forces which are required to complete a task, depending on how heavy the work is, might also put us at that risk. Sometimes it's about trying to lift a client, or trying to push a certain piece of equipment to a certain station, and that might then result in musculoskeletal disorders if not handled properly. Then the lack of the ability to grasp the patient. Our patients don't have handles, so sometimes holding them firmly so that they are also safe might tend to put ourselves at greater risk, so that we ensure that our patient is safe and hold them in a way that then puts us at risk. Then we talk about those clients who are totally dependent, as like the neurological patients that I was talking about, or clients that are unpredictable or competitive, that might just change in terms of their presentation, but it puts us at greater risk of developing musculoskeletal disorders. Then sometimes if the patient does not understand instructions in terms of what we need to do in a particular lift or in a particular movement, in a particular situation, it might also result in them then moving in the wrong way, which puts our body mechanics in a position that is not a healthy position, and result in that musculoskeletal disorder that I was highlighting. Then the various conditions can be in that state, and some of the competitive patients that we get come from those patients with burns, for instance, because of the pain and the trying to resist the pain, and whatever movements that we might want, they might then resist and move in a direction that would put us at a great risk of developing that musculoskeletal disorders. Or maybe it's a stroke and the patient does not have control over any of their movements, and that might put a lot of strain on us trying to then really ensure that we're handling the patient safely, which might not be in the best postures and positions for the rehabilitation work. So just to remind ourselves where the problem lies in terms of the body mechanics is, most of the weight, the body's weight, is then carried by the spine. You will see that, in anything that you do, if we start basically in terms of, just body weight, the center of gravity is located within the spine, in the lumbar vertebrae, somewhere between L4 and L5. And that space on its own, when you look at the anatomy, you see that this is the only space within the vertebrae which has a high weight load and very little support, rather. When you look at the sacral area, for instance, it is the support of the halo of the pelvic bones, or the pelvic girdle, which gives us extra support so that it doesn't move or shift, whether anteriorly, posteriorly, or laterally. When you look at the thoracic region, it has support of the ribs, which then act as a truss against unnecessary shifts of movement, which gives it better and greater stability. But the lumbar region does not have any of these bony attachments. It's just attached to the thoracic vertebrae above and the sacral vertebra, inferiorly. Then it is attached to a range of muscles that act in terms of maintaining our posture. So these forces, when generated, if you then take into consideration the center of gravity location and the lack of support that's there and the numerous muscles that are attached to it, it puts it at a vulnerable position to then develop musculoskeletal disorders. So you see that this is the place that usually then gets a lot of the musculoskeletal disorders that we're talking about. Oftentimes it is the ligaments and some of the muscles, depending on the extent of the injured, that then become injured. If the force is acting on the spine itself, then you will see that it is the ligaments oftentimes that get injured, because they are the ones that try to resist any movement outside the normal curvatures or the normal shape of the lumbar vertebrae. But if it is an external force that needs counteraction, for instance, you are carrying a specific object, then according to principles of biophysics and biomechanics, you see that there is a moment that then is developed, a moment of a force that is developed, or a turning effect that is developed between the object that is being carried and resistance of the body to then propel over towards that presenting force. So because the body is resisting to move into the pull of the weight of the object, or the weight of the load that is being carried, you will see that it then creates a moment of a force in which at one end, there is the force of the object or the load. Then it is turning about a pivot of the spine itself is our pivot point. Then the posterior muscles of the spine then act, so very small muscles, then act as the counter force to then stop this object from toppling over. So if you go back to your physics, you will then realize that this moment of the force is equals to the force times the distance from the pivot. This then means that, for instance, if a force is generated at a meter from a force of 10 newtons is generated about 1 meter away from, just to put an example there, if it's generated about 1 meter away from the pivot point. So this is we're looking at something with a weight of 10 newtons, and then the distance from the pivot is around 1 meter. Then it would mean that whatever is going to counteract that should have an equal moment, which is 10 Newton meters. So let's say that whatever is counteracting that is then at a limited distance, which is, say, in this case, 10 centimeters, for instance. It then means that the force has to be greater so that it, puts the moment into an equilibrium state. So the 10 Newton meters, for us to then get the actual force, would mean that would require something like 100 newtons. It does 10 centimeters to counteract the 10 newtons at the 1 meter distance. I hope that is making sense, because it is the whole rationale to which we then talk about, musculoskeletal strain to the back oftentimes. So you will see that the distance that exists between the spine and the small muscles that are counteracting whatever weight one carries is a very, very, very small distance, which exponentially increases the amount of force that is supposed to be generated by those muscles to maintain the posture that is there. So the further the load goes away from the body means the greater the force that the muscles have to generate until they get to a point where they can no longer sustain, and then they get strained. And that's when you then start complaining about back strains and things like that. So that's the relationship that then exists. the two things. So it's something that we need to be cognizant always about. Then sometimes, because of these forces, they might then end up, compressing the discs that exist between these vertebrae, which are, shock absorbers, which then may lead to compression of the spinal cord, which runs through the canal of the spine. And this might result in other neurological conditions in the worst case scenarios. Or sometimes, the various nerves that come from the spinal cord as they traverse through, the spaces between the vertebrae might be compressed, resulting in conditions like, your sciaticas and other, neurological conditions like that, peripheral neurological conditions like that. So we need to be cognizant about the structure of the spine vis-a-vis the amount of forces that are exerted on it and how it then resists these various forces for us to comprehend what really happens, during a lift by the result of musculoskeletal disorder. So this is just another section that is just explaining what I've highlighted. You see there, in terms of that disc that I was highlighting, which is a spongy type of structure, which is mushy to absorb all the forces that are there. So if something happens that results in the disc degenerating, it means that it will be bone-to-bone contact, increases the friction, which might result in degeneration of the bone and offset the structure of the spinal column, which then results in compression of the spinal cord. The other thing that we also talk about is if there's anything that might result in inflammation of any of the nerves and things like that, might also then cause a lot of effects to that spinal disc. In that example, it just gives an example of what they call a ruptured disc, showing some of the material pressing on the nerve there. So you might then find that this client will experience, or this individual will experience some paresthesia on some aspect of their body, which indicates that something has gone wrong with maybe the spinal column. So for us to then do away or avoid musculoskeletal disorders, it's very pivotal that we take care of our backs and that we are cognizant and conscious when we do certain lifts about all the forces and pressures and forces that are there. So how do we take care of our backs? So the most basic thing that we can do in terms of taking care of our backs is to ensure that we have appropriate and healthy lifestyle choices. Because sometimes without appropriate lifestyle choices, you might find yourself, having a very unhealthy vertebral column, which then is very susceptible to develop musculoskeletal disorders. So many factors can lead to disc degeneration, for instance. Things like lack of regular exercise. This might then the discs become a bit lax and flaccid, so that at the end of the day you experience that pain. Then you will talk about inadequate nutrition. It needs to be constantly renewed, given enough protein to become healthy. Then we talk about obesity. With obesity, there's an increase in terms of the weight. So remember especially for the lumbar vertebra, they are the center of mass. This is where the body experiences most of its force, the force of gravity. So if the one is obese and that weight increases, it means that there is going to be an extended pressure in terms of the extent to which there's a force that exists to that unsupported region, which then results in a lot of musculoskeletal pain and disorders. Then we also talk about things like the use of drugs and tobacco, which can lead to disc degeneration, like I highlighted earlier on. Then there's a lot of other things that also happen, like for instance, when we grow older, the discs become less and less flexible. Some of the structures become a bit weak as well, and that can lead to a lot of musculoskeletal disorders and pain, which are somewhat natural. But if we with regular exercise, good nutrition, we might reduce the effects of those ones. Then, consistently, being in a poor posture can result, strain in terms of the structures that are there that may lead to either degeneration or straining on the ligaments of the spine, or maybe some of the muscular structures, leading to low back pains, for instance. Then the habitual use of incorrect body mechanics, always lifting using the wrong muscles, always lifting in the improper position, or sitting in an unsupported improper position, can over time result in a lot of disc degeneration and musculoskeletal disorders. So some of the things we need to do to take care of our back include the following key points. The first one is, we need to use the most appropriate body mechanics. When we say the most appropriate body mechanics, we mean to use the movement or posture that results in the least amount of force to, the musculoskeletal structures. So that's what we call proper body mechanics. It means we are sitting properly in an aligned position that ensures that the whatever forces are distributed equally or on all the structures that are there. It means we need to utilize the most appropriate muscle for whatever action that we need to do and things like that. So even when it comes to carrying objects, for instance, we need to ensure that we have the object as close as possible to our body, so that we don't put a lot of strain to the various structures that are there. Then we talk about proper lifting techniques, using the appropriate lifting technique for whatever task you need to accomplish. There are a range of lifting techniques that are there, some of which we will share today, and we need to use the most appropriate and proper one. Then constantly find time to do a bit of exercise, so that our muscles have that are used to the action, are used to the working, and they become more stronger. They don't lose their acting and become weak. Then we need to also be stretching. The stretch allows the muscle to go to an optimum point of contraction, so that when it then does its work, it is coming from an optimum point. If it is not stretched, you see that it tends to then do more work to produce a desired effect than when you start by stretching. Oftentimes, without stretching, you might find yourself experiencing cramps or muscle sprains and muscle strains and sprains of ligaments. Then always we need to be in the appropriate posture for whatever activity that we are doing. So we need to be conscious about our postures, always align, being straight, in anything that we do, keeping the back straight, ensuring that, we don't bend over or, bend to the side or twist those structures. It helps to maintain, equal equilibrium and force around that structure. Okay, so some of the body mechanics, they are basic rules to ensure that we have good body mechanics. So the first thing is, we must always try to utilize the push than the pull. You'll see that with the push, you tend to be putting force into something, and the back tends to take an appropriate posture and position, and the force that is being generated is pushed into the object. By pulling, you tend to put yourself in awkward postures and strain muscles in the same light. Then the other thing we need to also think about is utilize what is called the strike zone. So the strike zone is a specific space between whatever actions that you are doing, which is important to ensure that you don't then strain yourself, and you don't then use excessive force, and the body, whatever object that you have is as close to you as possible. So that is what we call the strike zone. Not too high and not too low. Too low will result in you bending over. Too high will result in you stretching to try and reach whatever it is, which might put you out of the moment or the forces, training effect of the forces that are there. Then keep the load as close to your body as possible. This helps in terms of reducing that moment of the force that we highlighted. Also then resulting in less force being generated in the muscles, which tends to be very close to our pivot points, which is around the spine. Then try as much as possible to use abdominal bracing. Remember, we spoke about the lumbar part of the vertebra does not have any support. So by using abdominal bracing, what you are essentially doing is using the viscera and the soft tissues to become a rigid structure around that spine, almost as if you've created a rib cage that also starts that lumbar vertebra in position. So it helps that even when you use excessive force, the lumbar vertebra is held in position and does not move, forward or backwards or to the side, resulting in musculoskeletal disorders. Then always try to pivot with the feet, turn with the feet rather than twist with the spine. So when you turn with the feet, it means the spine is maintained in its, position and does not shift, and there are no undue torque forces around the spine, straining various ligamentous and muscular structures around that vertebral column. So you turn with the entire feet. So when you pivot with your feet, the whole body turns, and maintains the same forces across all those. Then as much as possible, try to ensure that you do what we call teamwork versus mule work. Teamwork means even when carrying a patient, when carrying a box of 24, 25 kgs rather, kilograms, try as much as possible to ask for help, have someone that you can hold the box together with, so that you don't put excessive force on your musculoskeletal structures, resulting in musculoskeletal disorders. Then the principles of patient handling include that whenever you are attempting to handle or carry a patient, always you maintain a wide, stable base on your feet. By extending your base, what you essentially do is you lower your center of gravity outside the body, so that the force is then equally distributed through all the muscular structures of the body, rather than at one central point within your spine. Then what you also want to do is put the bed that the client is into the correct height, like for instance at waist level when you're providing care. Why you want to put it at waist level when providing care is that oftentimes it is at this height that your hands are operating without you excessively bending over or stooping up to reach the patient. Then when moving the patient, try to bring it to the hip level, which then gives you a better biomechanical advantage in terms of shifting that weight and moving them as close to your body as possible. Then try to keep the work as direct as much as possible in front of you and avoid twisting. So whenever you're treating a patient, whenever you're carrying the patient, try as much as possible that the client is directly in front of you within the surgical plane, rather than having them to the side, which then forces you to then twist your spine, putting those forces on the ligamentous and muscular structures. Then keep the patient as close to you as possible and minimize reaching. As we said, most of our patients are way more than the recommended 23 kgs. So you will find that if you put them as close to you as possible, it means that you reduce the amount of force that you're going to be generating with your muscles, by limiting or reducing the risk of developing a musculoskeletal disorder. Then when you are wanting to handle a patient, there are certain things that you need to be cognizant of and prepare well in advance. So the first thing is you need to take responsibility of an understanding of the equipment that you want to use. So whatever, if you want to use a hoist, if you want to use whatever, wheelchair, whatever it is, you need to know exactly how it works. For instance, with the wheelchair, you need to know that how do you position the wheelchair to the side of the bed. You need to know where the brakes are so that you ensure that the client is safe. If it's a bed, you need to know how to adjust it to the appropriate height that you require it. And because if you fail to do that, you see that you start working outside the appropriate biomechanical limitations that might put you at a greater risk of developing musculoskeletal disorders, or it might then lead to the patient getting an injury. They want to sit the patient in the wheelchair, then the wheelchair rolls back, the patient falls to the ground. It might then lead to injury to both you and the patient. So always know how the equipment works and operate it appropriately. Then gather as much as possible, all the equipment that is needed and all the other stuff. If it's moving from a bed to a wheelchair, if a transfer board is available, utilize the transfer board so that at the end of the day, you minimize as much as possible the amount of force that you are putting into lifting the client from wherever they are. Then if others are available, remember teamwork always before new work. So you want to ensure that you also, do that and get someone to help you to carry them, depending on how big the person is that you want to handle and move and what you want to do in terms of the handling. Then the other thing that you want to also be cognizant about is do other team members also know what exactly they're supposed to do within that handling situation. If it's lifting, how are they supposed to move? What are they supposed to lift? At what order? Always keep communication open between you and your team members so that you know. Then position yourself, using the appropriate biomechanical principles so that at the end of the day, that you don't put yourself into injury. And as much as possible, explain to the patient what needs to be done, coach them in terms of what their role will be and what they need to do. In some instances, they need to also exert some form of force in the lift so that they assist. In some instances, they need to know that they need to be as stable as possible and not shift unnecessarily, which might result in that unplanned shifting movement, which results in injury to the patient or to the therapist or the rehabilitation work. Then you must always, as much as possible, ensure that the environment that you're working in is safe and that there is everything that you require for you to achieve whatever movements you want to achieve. So here are some types of handling or patient handling that we might want to be conscious of. There is what we call repositioning, which is shifting and adjusting the patient's position in the bed, wheelchair, chair, whatever supportive surface that they are in. So you must need to know how to properly reposition the client. In some instances, you might need to roll the client to another position. You might need to support a specific part of their body. If they have some movement within them, then you might need to support the bit of the body that they are failing to move, and then help them move what they can also in that activity. Then when the patient is moving from one space to another, now we are moving them from the bed onto the wheelchair or from the wheelchair into the tub, for instance, you carry out what is called a transfer. So these are guided and or assisting the patient from one surface to another, and the patient should be able to bear some weight. In some instances, you have them bear that weight. Then you look for an assistive device that can then take away that deficit in terms of the weight bearing that they can do. For instance, if you take a walker or cane, it might help them to then put some of their force into the cane that they can put into their feet or legs as they are trying to stand up, or use a transfer board. If they can, balance and they can scoot from one surface to another, using that and not necessarily, stand up to move or shift. So there are various types of transfers that are there that we can talk about. The first one is what we call an independent transfer. That's when the individual, on their own accord, mobilizes themselves. Oftentimes, these are individuals who are, quite functional, and they should be able to do this without, any discomfort on their part, and without any risk of injury. They can do it even, utilizing various mobility aids, and that is one way is an independent transfer. Then there is what we call a supervised transfer. That is when the rehabilitation worker is there to then, although the client can do, they might need some verbal prompting or cueing, or they might need the assistance of just to support a specific position in terms of how they shift their weight. So with that one, they do most of the weight bearing and the shifting in the transferring from one surface to another, but the rehabilitation worker is there to offer some guidance in terms of how they need to to achieve that, maybe instructions or things like that. Then there is what is called a 1% belt or pivot transfer. So this is why when, as an individual, you try to then move someone, oftentimes the person being moved needs to, first of all, be someone who requires minimum assistance and can move themselves to a certain extent, and the support that you're giving them should be no more than 18 kgs of assistance. Remember, there is a limit in terms of how much force you can exert on yourself. Then these transfers can also be performed, in the physician orders further. If the physician orders further toe touch or partial weight bearing. So if the individual can bear some weight, often this is what we then recommend. Then there's what we call a 2% or standing pivot transfer. Oftentimes this is done when there's no weight bearing that can be done. So remember, no mule work, teamwork is the way to go. So two people hold the patient, then they lift the patient, then without twisting, they need to then pivot their legs to move to whatever surface that they need to move on to. Remember, always maintaining the appropriate body mechanics as you transfer client to whatever position that you want to transfer them. Okay. Then there are a range of equipment that you can use that help in terms of making transfers or movement from one surface to another. These include your basic mobility aids like your walkers, your crutches, your canes, etc. Then you can use what we call hoist or mechanical lifters. That's the picture that you see here with a small bag and a machine. So what it does is that it takes the body away from the ground. Then with the wheels, you can actually move the client to whatever position that you want to move them. Then with this small hydraulic system that you see there, you can actually adjust it to go up and down, depending on whether you have reached the surface that you want to or not. Then transfer belts, are belts that are then put around the waist of the client. Then using that, you can handle the belts. Remember, our clients don't have handles. So you handle the belt, then you can use that to then lift the client to shift them to the surface that you want them to go to. Then there are what we call transfer boards, like the ones shown in the picture there, which you put in between the two surfaces. Oftentimes, the surfaces need to be at the same level so that there is no shifting forces that might affect the individual. Rarely do you find, in some cases, where they are put at different levels, but oftentimes the client needs to be able to move from, I think it's from a higher surface to a lower surface, if I'm not mistaken, which though is requires less forces in the direction of the force. Oftentimes the client needs to move in the direction of the force. If they move against the force, you might find that when they get to to the higher ends, the body then tends to topple because it no longer has support of the lower surface. Remember the basic seesaw principle that we're talking about, moment of a force. So when the force shifts across the midpoint, it then topples over and resulting in interpretation. But oftentimes, the basic rule of thumb is that they should be at the same level, which means that you have done away with, you create two pivot points that are at the same level, rather than a shifting pivot point on each. Then the other thing that people use is a monkey chain. Usually, it's for bed mobility and making bed transfers. So it's attached to the bed, and the client can hold onto it, use their full force of their hands to then move from one place to the other. Then there are also what are called sliding sheets, which are put under the patient. Then you can use the whole sheet to then move the patient from one surface to another. So this is a type of transfer that we call the lift. And you see what we use there is our mechanical device or the hoist. So lifts are any procedure that the patient's entire body weight is borne by someone or something other than the patient themselves. So you see them there being repositioned from one surface to the other using that. So the basic rules of lifting include that, the load should be as close as possible to the body. If you're doing a body lift, you should keep your back straight at all times. Ensure that the back is straight. Then turn your feet outward and push your buttocks out. By doing so, what you do is you lower your center of gravity, and you increase your base of support, make a wider base of support, so that then shifts away the force from your lumbar spine. Apart from that, it also gives the lumbar spine, a more curved position, or more curved shape, which is suitable for its own curvatures, and helps to protect it. Then you bend your knees, you lower yourself down by the knees, and it helps you to lower your center of gravity again. Then keep your head forward. That is to counterbalance the pushed out buttocks, so that you have a good moment of a force that's there. Your lift will be more balanced, and because of the spine stay balanced and aligned as I highlighted. Then you breathe out. Why you breathe out? Because you want to remember to brace the lumbar vertebrae. So when you breathe out, your diaphragm contracts. And when it contracts, it sort of like compresses the viscera that's in the abdominal cavity, and you see there that your abdominal walls also tend to become taut as you breathe out, and it creates a natural abdominal brace, which then helps the lumbar vertebra not to shift too much. So always when you lift, you want to breathe out as you lift. So some of the basic types of lifting that are there is what we call the basic lift, shown in the diagram there. So this is the lift which is most common, technique, uses basic principles of lifting, and ensures that an individual does not hurt themselves. It is usually for small objects that can be struggled over, and allow you to use a wide stance when you're lifting it. So you get close to the object as possible, then stand with a wide stance, put one foot in front of the other. Then you want to keep your back as straight as possible. You push your buttocks out. Then you want to use your hips and your knees to lower yourself down. So you lower yourself down to the level of the object by bending your knees and your hip, and then not the back. Keep the back straight. Then once you do that, you want to be as close as possible to the object. When you do that, then if the object has handles, you want to lift using the handles. But if it doesn't, you want to ensure that you have the object holding it with one hand at an opposite side of whatever object it is. By doing so, what you do is you create an equilibrium state. You create two moments that are in equilibrium, so that the object does not turn in any unexpected way. It's quite balanced, having two pivot points between your hands, and that counteracts the moment in some extent. Then you want to then put the other hand on the surface closest to you. You have that moment that we're talking about. Then grasp the object firmly with both hands. Prepare to lift, look forward. While you're looking forward, is you want to maintain that straight back that you want. Then lift yourself upwards, following your head. You lift yourself with your feet. You extend your legs. You extend your knees and your hip. You keep the back straight. And as you're doing so, you want to breathe out so that you maintain that abdominal brace. Then there is what we call the partial squat lift. You use your partial squat lift when you're having objects that have handles that come as close as possible to knee level, so you don't have to go all the way down to grab the object. So it's quite similar to the basic lift you see. So you stand as close as possible to the object. You have your feet wide apart. What you want to do is place your hand on a fixed surface on a table if you want to do a one-hand lift. So you want the other hand to be on some stable surface. And you want to keep your back straight. Push your buttocks out, slowly lower yourself to the object, the level of the object. Then once you do that, you want to prepare to lift, to grasp the object by the handles. Then with the support of the other hand, you want to push yourself up using the legs, extending your legs, the knees and the hips, and keeping the back straight. The buttocks have to be out. Then you breathe out as you lift. Then the technique we're calling the pivot technique often used even when you are trying to transfer the client from one position to another without twisting your back, requires for you to be able to, pivot with your feet. So while you use all these other techniques that we know to lift the object, it is pivotal that you then use the pivot technique to be able to turn whenever you want to turn, instead of twisting the back. Always keep the back straight, then you turn with the whole body. So how to do the pivot techniques is you lift the load using any of the techniques that we have highlighted previously. Then with the load very close to your body, you want to bring it to waist level, because that's near the center of gravity, and it helps you to have the smallest moment that's there in terms of it becomes part of your weight to some extent, if you put it like that. Then you turn the leading foot 90 degrees outward toward the direction you want to turn, then bring the lagging foot behind that one without twisting the spine or twisting the body. So that's the pivot technique in a nutshell. So that being said, ladies and gentlemen, we need to be cognizant that, whenever we handle patients, we need to remember at the back of our mind that our patients have a rigid structure, an uniform structure, and that it's not as direct and as straightforward as lifting, maybe a box, if you can put it like that. So we need to be able to think about it, say, this load is often unstable. Our weight is distributed. The head weighs less than the torso, which weighs more than the feet. So that's instability of the weight. We need to take it into consideration. Then our patients don't have handles on, as I highlighted. That's why we're using assistive devices like the belt that we spoke about. And the patient's weight is distributed unevenly. I think I've highlighted that. And oftentimes, our patients are not, inanimate objects that then just respond to our movement. They also tend to then contribute to some extent in the movement. So therefore, we need to be alert about whatever the client is also doing, so that we don't then harm ourselves. So that being said, ladies and gentlemen, we have covered the basics of safe patient handling within the care setting, as well as lifting that ensures both that the client and the therapist are safe and do not incur any injuries. I hope that this information will be quite valuable to you as you go and engage in your clinical work. Feel free to ask any questions that you might want to ask of me at any given point in time. I am available on my normal contact details, and hope to see you soon again for another discussion on how to engage in the various types of rehabilitation work that we're engaged in. So thank you very much, and enjoy the rest of your day.